Good afternoon, ladies and gentlemen. At this time, I'd like to call the Legislative Oversight Commission on Health and Human Resources Accountability to order. Chair will look to the clerk for the establishment of a quorum. The quorum not being established, we'll go to the first order of business. First order of business today is a presentation from Shavana Lusk, Chief Operating Officer. Actually, we're going out of order a little bit here. Is going to be Megan Bourne of the McChrystal Group. And I apologize for that. Megan, are you ready for your presentation? Okay. As is the custom of this committee, you will be sworn in. Please raise your right hand. Do you swear or affirm the testimony you're about to give is the truth, the whole truth, and nothing but the truth, so help you God? Okay, you may proceed. Please introduce yourself, say who you're with, and the floor is yours.
Okay, sir. Thank you. Thanks, members of the committee, for having us today. I'm Chris Fussell, the president of McChrystal Group. It's been our distinct honor over the last several months to be part of this analysis. Megan will be our lead presenter. Megan's one of our senior partners at the firm, joined by two others who will introduce themselves here in a moment. All played key parts in the last several months of data collection, analysis, and submission of the final report. Megan will present for about 15 minutes, and we look forward to questions from the group, which you'll essentially find. The bottom line is that our analysis shows strong agreement with the questions that were being asked in 4020, but our recommendation steers towards keeping a single DHHR with substructure with the goal of being at the lowest cost, quickest efficiency, getting to good results for the citizens of West Virginia, which is where Megan will take us during her discussion. Megan?
Again, I am Megan Bourne, also a partner at McChrystal Group. My specialty is organizational dynamics. So specifically looking at how leaders impact teams and how teams impact a broader organization. And I've been the project lead working with the team here. And before I go into our assessment, I'm going to ask Ryan and Ann to just quickly introduce themselves.
Hi, everyone. Thanks for having us today. Ryan Arzomarski, been at McChrystal Group 6 years. We ran the survey design, analysis, and presentation of all the data. So my team basically did all the design and research aspects of the study.
Good afternoon. Good to be with you today. I'm Ann Bailey. I'm a senior principal with McChrystal Group. I played a role in the organization assessment, primarily in the qualitative data analysis, interviews, and focus groups and so forth. My background is in health and healthcare delivery, as well as organization transformation.
Thanks, team. Okay, so before I dive into the slides and share more about the details in our report, I wanted to set a little bit of a broader context. If we think about it, the state has a really incredible opportunity to drive change. And we've heard about the challenges, we've read former reports, and in our interviews with everyone that we spoke to, as well as in the details of the survey, there is one thing that is completely consistent, and that is everyone agrees that we want better delivery of service to West Virginians and better health outcomes, health and human service outcomes for West Virginians. And that may seem obvious to all of you because it's something you want so much. But it's important to note because we work with other large organizations, for-profit organizations, where that is not the case. They come from all different perspectives and they don't have a common definition of success. So that's actually a strategic advantage. And I know that I'm going to go a little more into the why of that. But if we think about it, you in the room as legislators have this amazing power, policy making, budget setting. You guys can start to drive change, but you alone can't drive the change yourselves. The DHHR team has subject matter experts who can administer programs and really lead their teams in the field, but they alone cannot drive the change needed. There's also many external groups, other agencies, other associations, numerous advocacy groups, and they are also working in this bigger health and human services system, and they alone cannot drive the change. That is part of what makes this such a challenge. So that's where our team comes in, because that's what we specialize in, is how do you take multiple groups with differing perspectives and experiences and help them come together in a way that you then have the information, the decision-making, the power, the authority that you need to drive change. That sounds simple. It is not obviously simple. There's definitely some disagreement on the how, and that's where our assessment comes in. So that's what I'm gonna take us through now, is a little more about our approach. I'll then quickly touch on the executive summary, specifically the findings and insights, but I won't go into much detail because we want to make sure we leave plenty of time to explain some of the data and how to read some of the data, so that as you and your teams dive deeper into the report in the coming weeks, you understand kind of how to read it. And then we'll get to the recommendations and help really understand the how behind our recommendations. So for our approach, we were given the timeline of 120 days. And during that time, we executed multiple concurrent efforts to help us conduct the assessment and formulate a strategic plan at the same time. So the assessment consisted of a survey. Ryan and his team, Ryan mentioned the work from him and his team. We sent that survey out to nearly 5,000 people and achieved a 71% response rate. That's incredibly important, because in doing this with other clients, we always aim for a 60% response rate, because that allows us to say that the data is then statistically relevant. As you can see, we exceeded that by 11%. People across DHHR at all levels were incredibly looking forward to. It was open for just over 1 week, and you'll see it's over the 4th of July holiday, and we still achieved a response rate of that high. So that is a very impressive number that tells us people want to be heard and want to weigh in. Again, getting back to my earlier point, everyone wants to figure out how to help move forward. We did 65 interviews. Some of those were internal. They were leaders at the commissioner, deputy secretary, deputy commissioner levels, as well as a selection of directors. And then the external associations and other agencies that we spoke with, we selected them based on each of the bureaus and who they partner with most often. And then at the bottom, you see the note of the documentation review. We asked for a number of different types of documents, and every bureau and office provided the requested documentation. So those 150 documents range from strategic plans to budgets to some of the LACRA questionnaires from early interim sessions earlier this summer. So our team was really able to understand the broader context in which all of our data needed to be then considered. So this slide is a lot to look at. It is the executive summary, and what I'm going to do first to orient us here is if we look at the graphic at the bottom, those 3 primary categories for improvement seem pretty obvious: structure, strategic focus, operational processes. There were challenges in these areas that were known well before our team got here. And the findings that you see in the italics across the top were also seem pretty straightforward. That's why we say specifically, we confirmed the findings. There was all of you, as well as the DHHR team, knew that there were challenges and knew that there were opportunities for improvement. What's important and what really informed our recommendations are the insights that you see below the findings. Those insights are each supported by the data, and they really get at the core issues, the root causes of how to drive change for the finding above them. So I'm not going to go into each in detail, but specifically, I'll point out 1 or 2 examples. Under structure, you see the first one noting the need for an executive leadership team. This one, again, seems fairly obvious, but what we really learned here is that there are many very dedicated leaders throughout DHHR who are attempting to support their teams and deliver services to the best of their abilities. But given the crisis nature of the child welfare environment, as well as the substance use challenges across the state and the sheer volume of need for access to care, the leaders are constantly finding themselves in a more reactive environment. So this executive leadership team would be focused at that strategic level. I'll go more into that in the recommendations, but as an impact, the two below that you see are impacts of not having that team. It leads to siloed communications. And then also it's a challenge for the leaders at the highest level to get information from the teams on the front lines who are the ones doing the day-to-day work. And so again, it's more of that's the challenge. If there's an appearance of non-responsiveness or slow responsiveness, it seems from our analysis, it appears to be because of the pace of what's going on in each of these challenge areas and not a lack of desire to provide the information. The strategic focus, that was part of the RFP. So that was well known before we got here. We were asked to help take a strategic look at the agency. And what we found, there are many plans out there. But unsurprisingly, with this fast-paced kind of crisis environment and these bureau-specific plans, it then leads to more segmented, siloed approach, and specifically the over-reliance on key leaders. So the third grouping is what my team started referring to as the long list of process improvement opportunities. If you've read the 2013 Public Works report, you've probably seen many of these noted back then. Really what it comes down to is there's a lot of interdependency with other state agencies, as well as just complications with the funding, the sheer volume and type of funding and all the different sources that it's coming in from, as well as the corresponding reporting requirements that just make it incredibly complicated. And so but if you start to focus at the process level, it can just become overwhelming. And it's not clear what the highest priorities are and where there's so many interdependencies. So I'm gonna keep moving us through now the selection of data. Again, ideally, we would have time to talk you through more of this. So instead of trying to share all of the data, we've chosen a few key charts that I'm just going to explain kind of how to read so that you understand them better as your teams read the report. This is what's called a communications network map. We also refer to it as an ONA, organizational network analysis. Each bubble, and I apologize, it's not coming through as clearly up here in the projection as we would like it to, but each circle represents an individual. Each line going from one circle to another represents a mention of going to them as a good source of information. You see the question at the bottom that says list up to 8 people to whom you go to as a good source of information. And then what we see is the size of the bubble gets larger based on the number of times that individual was mentioned. This can help us start to see how communication flows. So not just, we then compare this with the organization charts and understand what does the hierarchical structure look like compared to how people are communicating. And what we see, this is again where you see that we recognize the impact of not having the executive leadership team. And I want to make sure it's clear that that is not to say anything against. There are many great leaders who are trying their hardest to lead this organization. It's just that they are the pink circles that you see spread out throughout this map. And ideally, in an ideal high-performing organization, we would say they'd be a little more clustered and close to the center so that they are helping drive cross-department connections and communication. And then not surprisingly, what we see as a result is a lot of siloing. And I apologize again, this is not coming through as clearly as we would like, but we can make sure there's a more high resolution version provided to all of you. But what we see here is each of the bureaus. We can cut this data a number of different ways. This one simply shows that you see a lot of clustering of different colors, which represents different offices and bureaus. Again, I'm going to keep moving us forward so that we have plenty of time for questions. We also have questions on a Likert scale that result in data similar to what you see here. The question there at the top is around decision-making. So as a result of these challenges with communications, the silos, we then ask the leaders at all different levels, are they able to make decisions, or does their input, their knowledge from what they're doing, able to impact the decision-making of leadership at the higher levels? And we see the drop off here by layer as you go to the front lines. I will say that's not uncommon. We see that in many organizations, but it is something to note of how can we get the information and the insights from those layered 4, 5, and 5 individual contributors up to senior leadership faster, so that then senior leadership is able to, again, make more informed decisions faster. It relates then, you see another version of our data here in the circle graph. It's essentially saying what's the ultimate impact here? Because decision-making in itself can be a challenge, but does the decision-making then slow our ability to execute and deliver services? And what we saw was a 25% agreement rate. So there's clearly a lot of opportunity there for people to have the decisions and the information they need to react more quickly. This is another subset of the data. Again, different, this then gets into finding 2 around the strategic focus. And what you see here, the biggest point to make here is really that drop from 57% agreement when you're asking about bureau or office level strategies down to 37% agreement. Again, this is not surprising because the RFP that our company responded to asked us to create a department-wide strategic plan coming in. It's simply that your people at all levels of DHHR see it and feel it as well, and they're reflecting that back to us in the data. Again, it's not just data for the sake of data. What's the impact? The impact is, what does that mean for collaboration? We heard time and time again in the open-ended responses that individuals at the director level and below recognize the importance of collaboration. They simply don't have the time or the information on how to do it. They talk about the populations they serve. They talk about the complicated needs and that many of the people they're serving are then also served by other bureaus, and they just can't communicate fast enough. And again, we see that in the data by the lower response rates about a question focused on collaboration. So now this is data that came from more of our comparative analysis across other states. The 2 biggest takeaways here are what you see there on the left. From our research, and we partnered with our subject matter experts at the Human Services Research Institute, HSRI, for this. There really is no single best practice for department structure. Many states are doing it in very different ways. The question is, what is right for your state? And if change is required, which again, it sounds like we're all in agreement that some type of change is required. The question is how. Change requires investment of time and funds. And so with all of this in mind, my team found ourselves not just asking the question of should the department be split or not. We kept asking ourselves the question you see here at the bottom of if change is necessary, how should West Virginia invest, DHHR specifically, their time and effort and funds so that whatever organizational changes are necessary, minimize disruption and provide the highest likelihood of ultimate success, those outcomes we all want to see improve. And so that brings me to our recommendations. I'm sure everyone has seen the report at this point that says we do recommend it remain a single department. And this is because we did not come to this conclusion lightly. Everything I've just explained really led us there. And now I'm going to focus more on the how. I have not done a quick time check, but okay. So I'll focus more on the first 3 and then can just briefly touch on the other 2 so that we still have plenty of time for questions. So recommendation 1 essentially is just to continue the strategic plan. This may seem, again, pretty straightforward, but the important detail is, and we wrote this up in our report about the exactly how this needs to be done. You see screenshots of examples of strategic plans that exist throughout the bureaus. Many of them have overlapping topics, and even sometimes they are consistent in what they say, and other times they are not. And again, that's not surprising because they have different federal regulators who are asking for different things. So it's not, again, this is not an indictment of the bureaus. They are working hard. This is incredibly complicated. And so what we said is there is, at the objective level, there needs to be more of an aligning narrative around what will ultimately get West Virginia to this successful future that everyone can envision. And it really comes down to three critical areas: the child welfare crisis, the substance use disorders crisis, and then access to care. And we specifically referred to this one, not just access to care, but also overcoming the barriers. So it's the eligibility piece and the actually not just being eligible, but how do you actually get access to the care and the services that you need. And then on the right-hand side, you see the other two objectives, which really are the critical enablers. Everyone in the leadership sessions where we facilitated was in alignment that none of this is possible without process improvements in the operational areas. And again, there's lots of interdependencies. There's a lot of complications that need to be addressed there. But the idea being, rather than diving into process improvements in one or two areas here and there, kind of stopping, getting all the right people in the room for technology or for HR or for finance, and talking about strategically what is going to get us where we need to go so that we are providing better, faster support to the teams on the front lines who are trying to deliver all the programs and services that align with the first three objectives. Thank you. And so a critical piece of this is that executive leadership team I touched on in the beginning. If you ask the commissioners to do this currently, it would be piling even more on top of them when they are already all having to not only run the day-to-day operations of their bureaus, but also, many of them are having to get down into the detailed tactical weeds of some of these crises that keep coming up, as well as then all of the offices that are not currently aligned all under one COO, but many of them are in a very reactionary mode as well. So what we're proposing is that you use deputy secretary positions that exist already, but you change the focus of them, that you have, and you align them. You can see the three there on the left would align to those three objectives that you saw back here on the strategic plan. And then this COO, Chief Operating Officer, would be responsible for the other two objectives. Two more critical roles are the State Health Officer, which we are recommending be split from the Bureau for Public Health Commissioner. Again, because of that ability to have the strategic up and out focus compared to the more operational day-to-day leadership focus. And then the Center for Threat Preparedness is just critical, as we've learned over the last few years. There's any number of emerging situations and needs. And so a team that is skilled and experienced in crisis and emergency response is really important to have at that strategic leader level. One more detail I'll call out on this one is the integration teams. And essentially what that is, you see the dotted lines. There needs to be the formal reporting structure of the bureaus of a traditional org chart, but there also can be built-in communications patterns to help drive the communication and the collaboration. And that can be done with a small integration team attached to each deputy secretary so that we're actually helping communication and collaboration happen. An important call out, and again, this is all, forgetting the exact page number now, but I think it's pages 22 to 28 in the report is where we get into detail about the recommendations. We have a detailed write-up of what each of these deputy secretary positions and the other ELT members would have responsibility for. One big piece of that would be accountability to all of you for driving progress against this strategic plan. And then a third, and then I'll stop here before we go into the others, is essentially this is what we would call an operating rhythm. What it really is a more intentional construct of how we're communicating and setting up the processes to say, what meetings are we already having? What emails are we already sending? Are they working? Are they to the right audiences? Who do they need to go to? Do we need to get, are there people who are not included who should be? How often do we need to be meeting? A much more intentional analysis of that built while you're also building out these detailed strategic plans will then allow you, as soon as those strategic action plans are ready, you then have the communications forums to very quickly push them out and gain more buy-in so that everyone at all levels of the agency knows what success looks like. And then again, leader development is critical. The behaviors are absolutely critical. And I also mentioned the importance of the COO. I talked a little bit earlier about process improvement. And before making any decisions around which processes to improve and how, there should be that strategic decision-making, getting those right groups together. So with that, I will open it up to questions.
Okay, first of all, we thank you for your attendance today, and we thank you for your presentation. And we will now open the floor to questions. And I've got a couple I'm going to start out with. I just want to get one clarification. So you're saying that currently 34 out of 50 states are already separated into two separate departments. Would that be correct?
No, sir, they're separated. We intentionally didn't say how many because some, like I believe it was New York State, have like 6.
Oh, okay, I'll stand corrected on that, but they're separated. 34 out of 50 states are separated.
Correct.
Okay, okay. And then the last question that I've got, and you alluded to the 2013 report from the Public Works, and now we've got a report 9 years later. Could you speak a little bit about the differences when you reviewed the findings of the 2013 report versus where you're at when you did your investigation now, and perhaps how many of those from the Public Works report in 2013, did you make any observations about how those got implemented or did not get implemented, and where we're at now compared to where that report suggested 9 years ago that we get to?
We did not do a deep line by line. I believe there was 76 recommendations in that report, if my memory serves me correctly. And that essentially gets to fundamentally what we believe in finding 3 is that the attempt, and so many of those were programmatic and some were process specific. But what none of them, or I shouldn't say none of them, what our assessment looked at was more of the broader organization. And when we saw many common themes around challenges that were process related that did relate back to the report, we did not dive deeper on them because our recommendation is that you focus at the organization wide level first before diving into more details. So we did not look at exactly how improvements have been made or not.
Okay, okay, thank you. Delegate Summers.
Thank you. So you're saying you didn't do any process analysis at all, no Six Sigma things on how things are run through different departments. You just stayed at the structural top layer.
We did look at processes specifically. Many of those documents that we received were process specific documents and we reviewed them. We did not conduct Six Sigma type efforts to look at process improve, how you would improve those processes. There's simply too many of them for 120 days.
As a person that's a hospital employee who works in an ER, which is crisis centric all the time, I read your strategic plan, and to be quite honest, I mean, in 1 minute, I can know that my mission is to improve healthcare. I mean, my values are to have more access to care. What are your different things? Your values, your mission. I know what my roles are. I need to collaborate with others. I need to be respectful. I need to be accountable to my actions. I mean, that's the gist of your whole thing. But by God, as a worker, I need to know how I do these things. Like I need to be provided. When I read your things where people don't have phones, people don't have internet, people don't have the tools to do the jobs they need to do. They don't have enough help. Those are the things that I'm worried about that you didn't even look at because we spent all this time developing a strategic plan that I could have put together in 5 minutes. So how do you get into that deeper part that we're worried about instead of just telling us we need to add 2 more layers of management, which we've tried all those things in the past. We've had 3 deputy secretaries. We've had integrated teams. Like that's where I'm worried about the crux of the report that I need you to help me understand.
So I have a few thoughts there. Let me start with, I want to make sure we agree that, and that's why we provided some of those quotes around what people were telling us, technology, HR, technology, HR, and financially, processes that are not working. So we agree that the workforce needs to know more about how those areas are going to improve. I wouldn't say that we only focused on that. We learned that from the survey responses as well as from the interviews that we conducted. And to the other point of your question, I guess the creating the strategic plan, we didn't know as much obviously before we got here. And when we got here and saw the plans that existed already, we recognized there's already a lot of detailed action initiatives with milestones and metrics in place. It's just that they are all down in the detailed weeds of the bureaus. And so we did focus on what we would call strategy alignment, because to your point, writing a piece of paper, I agree. You could write a strategy on a piece of paper in a few days. The challenge is assessing leadership alignment around that strategy, whether it's a hospital or a department, large, complicated department, assessing whether or not leaders across that department are in alignment with that. And we did find that we got to alignment and that leadership across DHHR was aligned very quickly on the top 3. Once we got to the objective level, that's where we saw a little bit of what we would call misalignment. And again, this is outlined in Annex A of the report. That basically each of the different leaders had a different area of focus and different idea about what should be the primary objectives. And if you have a plan with 10 objectives, you essentially are reinforcing silos. And so that's why our plan recommended, what does the environment need? Not necessary, and is there alignment or misalignment about the leaders? So I don't know, I apologize. I'm not sure if I answered all of your questions there.
Thank you. I have a couple other questions, but I'd like to let everyone have a chance and then we could return.
I'm sure we'll have time to come back. Thank you. Delegate Tully.
Thank you, Mr. Chairman. Thank you for being here. I listened to you being very proud about your 5,000 member survey and greater than 70% response rate. Can you tell me how you sampled that survey and who was sampled in the survey specifically? Because we've not seen the data on the sample. So I think you probably agree that you could have actually some bias in your data if you're sampling everybody at the top of the survey, like at the top of the command chain, and maybe not some of the people at the bottom. So I'd like to know who you sampled specifically. I'd like to see that data.
Yeah, so we can share that what we did was I believe it was 4,800 and some permanent DHHR employees at all levels. So we went and we actually, that was one of the first questions that we asked Secretary Crouch, was we strongly recommend that you provide the opportunity for the survey to go to every single member of this agency. And he took our recommendation.
Okay, and so then out of the 65 that you did the one-on-one interviews with, number one, did you have a survey instrument that everyone was asked the same types of questions?
It was not a survey instrument, but we had a set list of questions, yes.
So you did have a set list of questions, and can you give me the data on who you sampled out of the 65?
We can share the full list. I mean,
That would be great.
yeah, we can share the list. And some of them were external organizations where those leaders chose to bring 3 or 4 people into a session, for example, like hospital associations, and then local health districts, things like that.
I think it's very important that you share that full list with this committee, so that way we know who is sampled and who has been asked the questions, because I think it's definitely fair I think we want to be fair definitely to the people that are actually putting their hands on the patients or the people that we're providing services to. I think that's one of the issues that probably would help communication. Also, I kind of, what I'm hearing is that, we're not recommending to split the bureau, but yet I think that there is a communication issue. And I'm wondering if maybe the current leader has so much to handle that that is why he's not communicating so well with some of the other teams or some of the other members of his team. I don't know that I think it took a consulting group to come in to tell him that he should be communicating with some of the other leaders in the bureau. And so I have some concerns about that. And I'm not trying to be ugly, but I think that that is something that he could have implemented independently as the leader without a consulting group. Thank you.
Thank you, Delegate. Delegate Pushkin.
Thank you, Mr. Chairman. And thank you for joining us today and for presenting this report. Just a couple of questions. To follow up on the question about the type of sample and the interviews. Were there also interviews done with constituency groups affected by it that, like, say, foster parents, other groups that work with the agency?
We did not interview constituency groups, no.
So, okay, then no constituency groups were included. All right, I'll just, one question. At the current funding levels for the department and workforce levels, is it possible, will it even be possible to enable in the execution of these objectives?
I'm sorry, I'm not sure I follow your question.
Will we be able to enact the recommendations? We've got, in my time in the legislature, I've seen a lot of different studies with a lot of different recommendations. Unfortunately, a lot of them stay on a shelf somewhere after they're presented. At the current funding levels and workforce levels at the agency, what's it going to take to actually enable to enact these objectives?
As far as what, for the first 3 recommendations, with focused effort, you could achieve those within 4 months. You could have very detailed, built out strategic action plans and communications processes. The challenge is it the same people who are currently delivering services who have to do that? And are we putting more responsibility on them? So I guess that's, and otherwise, as far as does the agency have the budget? I can't make that decision. That would be up to agency leadership.
That was really the gist of the question. At the current levels it's being funded, do they have the budget to even do it right now? But you can't answer that. All right.
Yeah.
Thanks. That's all I have. Thank you.
Thank you, Delegate Reed.
Thank you, Mr. Chairman. I got to start with 2 questions. The first one has to do with the funding of DHHR gets about $7 billion. If we know what the split is between that $7 billion between health and human services. And I heard you mention that the funding how the funding comes in has been a problem within DHHR. Would there be a recommendation to maybe split DHHR up into funding groups, how they're funded, so they can concentrate more on the money coming in part?
Split it up in, I guess it is currently split between health and human services. My understanding from the financial documents we reviewed is that they do currently do that. They have different accounts for health and human services.
Yeah, I guess my point is that you said that there's these silos that are there, but some of them are due to how the funding comes in. I guess different requirements. Could you split? Is it possible to split that up into actually silos that apparently already exist into funding groups, I suppose, so they can concentrate on how the funding gets brought in?
So it's probably easiest to try to explain like a quick example here, because for example, SAMHSA grants are coming in as well as CDC grants. There's multiple federal agencies that are all providing funding for substance use disorders, kind of combating the epidemic of substance use across the country. And those sources of funding have requirements and regulations attached to them. That's why it actually allowing the bureaus to keep that consistent while having this layer that is more strategically focused on driving collaboration so that you can use the different sources of money and the different experts in the various bureaus working together more collaboratively would allow you to make better use of that money in service to population health.
Okay, thank you. My second question is, would or should we consider maybe relocating some of these divisions to other agencies? And an example is, let's say environmental engineering, which does permittings for water. Should that go to DEP?
We did not get down into that level of detail where we could make a recommendation for individual divisions and where they should or shouldn't go. That would be up to the agency's leadership.
Okay, thank you.
Okay, thank you, Delegate Summers.
Thank you, Mr. Chairman. In your top to bottom review of DHHR, how did you rationalize the current structure where we've got service providers and then we have regulators, oversight agencies under one umbrella that reports to one boss? Do you see any conflicts of interest there?
Just to clarify, are we referring to the Office of Health Facilities specifically?
No, we're talking about a lot of different things. We've got Medicaid providers and we've got hospitals, and then we have the Office of the Inspector General. We have all kinds of, we've got groups, and I'm sure, I'm assuming you looked at all the different agencies under DHHR, but there are service providers, and then there are people that regulate and oversee those providers, all under one roof, all reporting to the same person. How is there no conflict of interest that shows that this structure works?
I think we would agree that the current structure is not working.
Right. And so in House Bill 4020, our recommendation was that we removed those so that they did not report to the same person, so that there were no conflicts of interest. But your report says we should definitely keep them together. So I'm assuming you've taken that into consideration.
Yeah, I was going to say we were not aware of that. Part of what 40 was behind 4020 was a conflict of interest. So we would recommend the changes, stand by the recommendation that we made.
So the Office of the Inspector General's attorney reports to the attorney that is the general counsel for the Secretary's office. And you think that structure works?
No, we have said that the current structure is not serving the needs of West Virginia and should be changed. If there are additional changes, like what you're explaining, that could certainly be looked at.
But how would you have a different person that you reported to if you only have one department head?
Well, and that's where we would say the accountability piece comes in of, yes, the department head, there is one department head, but with each of those deputy secretaries, then being part of their job description would be to not just lead strategically, but to be accountable to all of you and have a regular meeting with which they report to all of you on the progress they're making and the actions that their offices are taking. Or in this case, if the IG and the Attorney General are doing certain investigations in their area because they're not making progress, that would be, again, how the group of you here would be brought into that oversight process.
So maybe we could go back and look at the slide with the structure, but I thought the deputy secretaries were over the services type providers.
Yes, and so I guess what we would say here is if there are additional changes where there are conflicts of interest, we would not disagree that if there is a clear conflict of interest that needs to be addressed, that we support the state making whatever decision needs to be made to fix that conflict of interest. As far as accountability of the agency, if those investigations into the different services being provided programmatically relates to all of these different members of the leadership team, that's where they would be more closely connected with all of you.
I mean, I'm sorry, but we paid you $1 million to help us set up a better structure under one roof or two, as we had recommended, And the way you have it set up, I've got my Office of Inspector General, I've got my health facilities, I have them all reporting to the DHHR secretary, but then underneath of the deputy secretary, the secretary and the deputy secretary, I have the people that the OIG is regulating. I mean, you drew this, you think this is a good idea. I'm just trying to understand your perspective.
So I'm gonna say, I've shared.
There
our
were
perspective.
no, in all of our discussions and surveys and open sessions, et cetera, no discussions of conflicts of interest being a problem. And there are other states that have, single models, and there are other parts of industry, military, et cetera, where those things sit under one roof. That did not jump out as an immediate problem to be addressed.
I'll just make one comment. I mean, just because other states do it doesn't mean it's right. That's why we paid you to analyze this for us and tell us what a good structure would be. Thank you.
Thank you, Delegate. Senator Woodrum.
Thank you, Mr. Chairman. On page 12 of your report, you indicated that only 27% of respondents agreed or strongly agreed that leadership at the DHHR is receptive to new ways of doing business. Yet your plan as you presented, has fairly bold changes in it. And there seems to be a contradiction here. How do you envision that would work, or will it work based on that statistic?
That they are receptive, the 27% agreement that senior leadership is receptive to new ways of doing business. Is that
Yes.
correct? And so the question is, how do we?
Yeah, when you have only 27% of the organization that thinks they're going to be receptive to a new way of doing business, and you're proposing this.
It's not
change.
that those people, 27% will be receptive. It's that they, based on their current environment, their current experience of how things are running, believe that senior leadership will be receptive. But that's where, by making a decision to move forward, is the first step to showing the receptiveness to change, and then having a very focused plan on how to drive the change and communicate. That's why recommendation 3 is so important, because it focuses on communicating with those leaders at the front line so that they can gain the faith that the change is actually going to happen. That recommendation 3 really is the first few steps to help bring that percentage up.
But might add just one point on that. In our history of doing this with other large organizations, much larger organizations, anytime there's an organization going through real trials like we see here, that's very much in range of this isn't going to change. And so we believe speed and focus is going to be critical. And you can, and we have examples in our own history of pivoting that mindset relatively quickly. But it's understandable a workforce under pressure is likely to trend toward thinking this, we don't have the system in place to drive this sort of change.
On page 13, you had indicated that only 25% of all the respondents agreed that decisions are made in time for effective execution. And is that a correct statement?
Yes, sir.
No, to me, this is a horrible statistic for healthcare. How does this stack up among some other states?
I would have to look into that, have our data team look into that and get back to you. I can't say that for certain off the top of my head.
But in general, you would agree that this is a poor statistic for a healthcare organization?
I think it's a poor statistic for any organization.
Thank you. Thank you, Mr. Chairman.
Delegate Pushkin.
Thank you again, Mr. Chairman. I guess I'm trying to get to the more of the details of how these improvements could be enacted. So, as part of the plan, would you foresee like any process mapping done like on exactly, what needs to occur to improve each department? And if so, who would be doing that?
I would foresee process mapping as part of broader process improvement efforts
Mhm.
once the strategic plan is in place. Because an example would be for HR processes, all the way from recruiting to how we're retaining people. There's a number of HR processes that could benefit from improvement. the question on which ones to focus on and the how of changing them before you get to process mapping, you need to talk about, the dependencies on the Department of Personnel and how, whether there is a split or not, there would need to be some strategic decisions around, is it one centralized team of HR leading these process improvements, or is it more of a decentralized model? So again, that's where we would say, yes, process mapping, absolutely, but that is not our recommended starting point.
Okay, gotcha. Thanks.
Any other questions to committee? Delegate Reed.
Oh, thank you, Mr. Chairman. So I went through, I'm also in healthcare, been in healthcare for 30 some years. And I read through the report, and quite honestly, it's like basic management 101, a lot of it. So my question is, the RFP that was put out, what exactly, or in a summary, what was the parameters on that? Was it supposed to stick to like a general oversight of the whole thing, or how far in the weeds were you supposed to get?
We were asked to do what it was called a top to bottom review. And the way we proposed it was exactly as we executed it. So I would recommend reading the proposal, and our proposal that was the winning proposal was exactly how we executed it.
Okay, thank you.
Delegate Summers.
Thank you, Mr. Chairman. I just had one other question. So the Office of the Health Facilities, is a big office. Many issues, many complaints. They're required to take care of hundreds of violent individuals. But I saw in your report that only 35% of those people responded because you stated they didn't have access to a computer or a laptop. But this was done over 17 weeks. Did you consider reaching those people in another method such as mail for a survey? Or you get it on the computer, if you don't have a computer, you don't respond?
We did take one approach to the survey, which was electronic.
And so you felt like 35% was a good return for those individuals to get a good feeling on one of the agencies that creates one of the biggest problems for DHHR?
We knew at the time, the survey was only open again for the first probably 2 weeks or so of this assessment. And we did make concerted efforts to get higher completion rates in OHF. So ideally, it would have been a higher response rate. I agree.
Okay.
Delegate Tully.
Thank you again, Mr. Chairman. Did you look at, examine any of the past failures of DHHR when you did some of your assessment and looked at the communication issues that exist?
When you say past failures,
So we had one of the ones that sticks out in my mind. Sharp Hospital lost their CMS accreditation in 2017 because of some major issues that went on there. They didn't regain CMS recertification until I think 2019, 2 years later. So they were excluded from putting Medicare patients there that may need site care in that facility. Did you look at any of the communication breakdowns that may have happened with that type of situation, or any other types of failures with foster care, anything like that when we formulated the strategic plan?
part of what are the documents that we reviewed were audit reports and inspector general reports. So we read about them and understood that there to be communications challenges, which was consistent with what we were finding. So we would agree that across the board, there are communications challenges.
And so now we think adding another layer of, I'm just trying to get this clear in my head. We're wanting not to split the department, but add another layer of bureaucracy, or 2 more layers of bureaucracy to the communication process that's already hampered.
I want to understand though, when you say 2 layers, what are the?
I mean, I'm assuming that you're wanting like another, maybe like the proposal, they have deputy, I guess, some deputy secretaries or additional team members that are going to be inserted into the schematic drawing of the organization.
So, and yeah, we would consider that one level of any organization, no matter what they're doing, should have intentional focus on strategic, operational, and tactical areas. And what we see missing here is the strategic focus. So those positions already exist. We're recommending that they be more focused so that they're better able to help with strategic intent, which is to get to better health and human service outcomes.
Thank you.
I have a couple of questions. I think we may have a couple more members have questions as well, but on page 10, you talk about successful change requires investment of time and funds. And then you go on to say insights from Michigan's 2015 consolidation, and then insights from Alaska's 2022 separation. Could you share some of those insights that your group gleaned from those two examples? Could you share that with the committee perhaps?
Yes, and they are on pages 20 and 21 of the report, the explanations of them. Specifically with the state of Michigan, they chose to consolidate back in 2015. And 2 years later, they did an assessment. It was required in the bill that consolidated. They were required to do an assessment to to report on progress. And essentially what it found was that they could not concretely give a progress update 2 years later. So that's the idea that, and essentially their conclusion in that report was that they needed more time to successfully execute the change of that magnitude. So that's the idea, that time is absolutely required. The Alaska is this year, many of you may already be aware, similar to West Virginia in Alaska's General Assembly session this same year. They also put forward a bill to split and it made it through and they are working towards that. Their current estimate of cost is $2 million and they are significantly smaller than this state. And their assessment of that $2 million is primarily workforce focused. But what we would say is fundamentals of change management kind of would ask that you at least intentionally consider workforce, the impact on the leaders, specifically the impact on process and technology, that there's any number of categories that will have potential costs associated with a change of this magnitude. So again, we would say that Alaska is likely still underestimating the cost of change, but theirs is at $2 million.
Could you speak to whether perhaps in reviewing Alaska, did they see any benefits as far as service goes?
That's another point we make on pages 20 and 21. Every change, whether a consolidation or a separation, indicates the intent to improve health and human services outcomes as the reason behind the change.
But are they seeing it?
They haven't started. Their bill just passed in March of this year.
Okay. My last question is about something that I think you said, and I just want to get some clarification. And if we need to, we can have somebody from the department clarify this. But there was a question asked about accounting, and you said that and financials that you had already reviewed as part of your engagement. That it looked to you like the social services and the medical services were already accounted for separately. Is that to clarify that that's what you meant to say?
Yeah, our understanding from what we read is that in their budget, there is what they call the Division of Health and the Division of Human Services.
Okay, so they're already accounting for that as financially as though it was two separate departments. Is that a correct statement?
That's the extent of what I could tell you. We would have to ask Tara, the CFO, for more additional. I would definitely recommend that more about the how that works. That's what we saw in the reports that we did see.
I believe I would like some clarification from the agency here in a second on that, because I believe that's an important point. That's my question now, Senator Woodrum.
Thank you, Mr. Chairman. Just turning to workforce for just a minute, because we're all having trouble obtaining and retaining employees. And on page 20, there's a stat there that only 27% of the respondents agree or strongly agree that the HHR cares about its employees. Is that correct?
Yes, that's a
Yes,
correct
okay.
stat.
And also on page 20, it said only 41% agree or strongly agree that they will be working at the HHR in 5 years. That seemed to be a correct statement.
Yes, that's the correct
Did
stat.
they give you any reasoning for that, or did they just, is this just an answer to a series of questions?
I want to say, I might ask my team member, Ryan, to come up, but I sent, my first thought there is essentially that it's not, when we see low responses, low percentage of agreement to those two questions, it often is driven by the person, what we see in the other data points, which is the frontline leaders not feeling like they have the work for the team members, the processes, the information that they need to be operating as quickly as they want. So that it is an unsurprising stat when you realize that they are essentially not feeling like they have all of the resources they need.
Okay.
And is there anything you would clarify?
Yeah, just to further answer that question.
Use this one. I don't think that one's working.
So the first question that people answer when they take the survey is, what is the biggest challenge to your role? And we code all of those responses thematically. The number one theme that we saw, which links to to the stats that you just brought up, were people are frustrated at pay grade. People are frustrated at seeing their colleagues to the left and right of them leave the organization, so retention. And thirdly, people are frustrated around the way that the promotion and ability to move up through the organization is structured. So essentially performance management. Those are the three themes that come up in that open-ended response. And so my team linked that directly to, and I think we technically misspoke a little there. It's the 5-year question is about whether you're motivated about the future of the organization. So you see some frustrations looking at regarding the 5-year window of the organization in the future. And you see some frustration about whether the people feel cared for by the organization. The latter connects to a lot of those open-ended frustrations that we heard about, again, moving up through the organization, seeing a lot of retention issues in the organization traditionally, and thirdly, again, pay grade.
All right, thank you.
Thanks, sir.
Are there any other questions before we have somebody from DHHR come forward? None being seen. We did have a question about the accounting process that was raised. Looks like Secretary Crouch is going to come forward. I believe we do need to swear you in. Do you swear or affirm that the testimony you're about to give is the truth, the whole truth, and nothing but the truth? So help you God.
I do.
The floor is yours. You may proceed. Please state your name and position for the record.
I'm Bill Crouch, Secretary of DHHR.
Our consultants said that they talked about the accounting already being a bit separate between social services and the medical part. And could you elaborate on that a bit?
I think that's a reference to the Medicaid payment. There is a Medicaid social services part of that. That's not to say, I think your question is it kind of clear cut where there's a health budget and a social services budget?
Well, that was my impression of what she was trying to say, but I'm giving you a chance to rebut that.
Yeah, that it is not that clear cut. And I think what they're referring to is a Medicaid issue regarding medical payments under Medicaid. There's also a social services budget there. That is not all of DHHR's budget. So there are a lot of other pieces there. A lot of those funds cover payments for different funds for the same person. So if we have an individual who's working in one part of DHHR and providing services basically for two of those funding streams, I've talked about 143 separate federal money funding streams, over 200 funding streams, including the state funds. So those are intertwined in some places. It's called braided. So because the feds don't want you to merge those funds, you have to be able to audit and track every one of those accounts in DHHR. So if an individual is being paid 50% by one fund and 40% by another fund and 10% by another, we have to be able to identify that. So there are time studies that determine who is paid what. Some are done on percentage of services or time percentage. We can get our CFO happy to provide more information on that. But it is not as clear cut, to answer your question, that there's a health fund and a social services fund.
And I'm going to go back to our state budget. And in our state budget process, I believe there is a delineation between health and human resources, and there's several different line items there. Is that correct or incorrect? Now, I appreciate, I think what you're talking about is the federal side of your budget. Is that correct?
It's both.
Both.
No, yes, sir. So there are, and I don't have the number, Delegate, Mr. Chairman, there are, I believe, 40 to 50 state federal funding streams in DHHR. So it is federal and state. Some people are paid half state dollars and half federal dollars. We have a great mix there, and the feds are very specific about how we do that. And that's why they require different methodologies and different funding agencies require different methodologies in terms of how those allocations are made. So we're happy to try to explain that in more detail, but it is truly the federal guidelines that rule how we do that. Now, on the state dollars, again, if we have somebody, we may have somebody, and very common to have somebody paid 50% state funds and 50% federal funds.
Okay, so so you're saying that it's not as clear cut as saying that it's separated.
Yes, sir, that's correct.
Is it possible to separate it?
We started looking at and when the bill was introduced last year to split the department, we began to look at how to do that because it would require a fiscal note. There was no fiscal note requested. I believe we were up around $4 million in terms of what it would cost to try to split that, and looking at those dollars and how you unwind those dollars. But that was not completed because we were never requested to do a fiscal note.
Okay. Delegate Pushkin.
Thank you again, Mr. Chairman, and thank you, Secretary Crouch, for being here. Even as most of us did, I supported the bill to separate into two agencies, although I tend to agree with that part of the report that might not be the answer. If you have two poorly functioning agencies, doesn't make it better than one poorly functioning agency. What could be done to address some of the issues that are in here about poor communication, lack of team building? The overall, I mean, if this is what we're getting back from the people who work at all these different bureaus, what can be done to improve the atmosphere there so we're able to provide better services for the people who need it?
Yeah, great question. And what McChrystal did was a little different. I will say I was hands off on that when they came in. I started the process on day one, and then I stepped back away from that. I did not want to be seen as influencing that. And I told the McChrystal folks on that very first day, whatever their decision was, that I would support that. And this was an effort to try to look at it at how we can help reorganize West Virginia DHHR. The issue really was different from their perspective. They looked at this, I think, the way I looked at coming into this job, which is how can we improve healthcare in West Virginia? We're 49th or 50th in almost every category and have been since I was a child. We're first in cardiovascular disease, obesity, diabetes. They looked at what our primary concerns were, which is child welfare, which is the SUD problem, which I've said before, hit me square between the eyes and stopped me from getting into all those other issues I thought I was going to get into because we're still #1 in the country in overdose deaths. So that's why they set up deputy secretaries for child welfare and SUD. They really looked at how do we improve those numbers and bring West Virginia up from where it is. I will be honest, I want deputy secretaries in there. I want help. This has all been in kind of limbo because, and I can't hire people to come into a department and say, you might get split and you might lose your job or you might get changed. So I was trying to do this quickly from the trying to get this done quickly in terms of the standpoint of moving on and getting folks to do that. The communication piece right now, I have meetings once a week with the commissioners and office directors once a week. Bi-weekly, I have meetings with each of the bureaus. I have a steering committee weekly with all of the office directors. And that goes down. They do that from their perspective down. The communication piece, we need a few more people. And that's what they talk about with regard to a leadership team. We need a few more people at the top. I'm not able to look forward and plan and really look at what needs to be done in the state without some help. And we talked about the crisis management piece. Gosh, we spend hundreds and hundreds of hours trying to answer questions. We're hiring, we posted one more person, we're going to hire 2 to respond to questions from the legislature and outside entities, because we do that. We spend so many hours doing that. Our folks can't do their jobs. So we're trying to change and this can do that, change that communication piece and that organization piece so that we have more people in the loop, so that we have somebody who can really take charge for child welfare. We tried that once and it hasn't gelled, but we're getting there now. We have crisis management teams for children for mental health throughout the state now. We're going to build a crisis center for children. We have 3 bureaus, commissioners that were invited to speak at the National Medicaid Administrators Group to tell others how we were working together to take care of mental health services for children. They're communicating at the top level of our bureaus. I think what McChrystal is, I don't want to speak for them, but I have had a little discussion with them about this. The communication drops off as you go down. So delegate to back to your question again, the communication piece has got to start at the top and go down. I can't do it all. I certainly try, and I spend a lot of time doing that, but we've got to have more people at the top. We need a couple, 3, I think is good, deputy secretaries to assist with that communication and make sure things get done and move down.
Okay, well, thank you. Delegate Reed, this probably have to be the last question, but Delegate Reed, we'll save the best for last.
Yeah. Thank you, Chairman, Mr. Crouch. I got really a question going back to the workforce, which was alluded to earlier. What do you need? The workforce out here in general in healthcare is awful. I can't find employees. We're all burnt out. I assume that's happening along your borough. And there's a theme in this paper about people running and putting out fires. Okay. And even in my own healthcare arena, I tend to be doing that a lot myself, running to put out fires because I can't find the help that I need. They either due to the fact that I can't pay them what they're asking for, or the talent just isn't there. What do you need from the legislature to help with your workforce issues? Because I have a feeling that they're pretty massive issues.
Thank you. That is what I always talk about as being the 3rd priority in DHHR: child welfare, SUD, and workforce. We have huge problems, and you hit it right on the head. I mean, we can't pay people, we can't find people. Even it seems at times when we are willing to pay people, we can't find people. And this is a national problem. This is not just West Virginia. What I keep hearing is higher pay. And we used some ARPA funds and we pushed it out there to try to increase salaries for group homes and folks, so that, because that's a huge problem. We have some group homes where we have 8-bed group home and they can only take 6 individuals because they don't have enough staff to take care of 8. And yet we've got individuals in Sharp Hospital that can be moved to a group home. So the only thing I can tell you right now is I'm told it's more money. That's what I'm told. Now, we also have a good example of where we put more money into the system. We increased CPS workers 35% in 3 years. I doubt if there's any other state in the country that's done that or done more for CPS, for child welfare in the country than we've done. We still have a turnover problem that's about where it was before. It's a little bit slightly higher, but it's about the same. So that kind of indicates money's not the problem. So I've required middle management throughout the HHR, starting about 5 months ago, all to take management courses. They've got to understand how to treat people, how to deal with people, and how to manage people. And we have a workforce that's unbelievable. They've stuck with us. We've got an unbelievable group of people. CPS workers are just champions. We also have in Sharp Hospital, taking care of people in a psychiatric hospital. Holy cow, it's one of the toughest things you can do. We have great difficulty hiring people and keeping people in hospitals. Now we got 41 new nurses by putting incentives out there. So that's helped us doing an incentive program or retention program for nurses. We've hired 41 new nurses. I'm sorry, let me get my numbers right here. 34 new nurses. And we got 176 nurses to sign something in that they would stay for 2 years with a retention bonus. That cost a lot of money. That was $2.2 million. So it goes back to money every time. I wish I had a better answer for you, but workforce is a huge, huge problem.
Okay. No further questions at this time. I will announce to the committee that I think our presentation from the Office of Health Facilities is going to be carried over till the December meeting. I know there'd be a lot of questions about that, and I just don't think this committee has time to take that up at this time. So we will be taking that up at the December meeting. At this time, is there any other business to come before the committee? No further business being seen. The chair looks to the co-chair for the purpose of a motion.
Mr. Chairman, I move we adjourn.
Co-chairman moves for adjournment. All those in favor of the gentleman's motion, please signify by saying aye. Those opposed, no. The ayes have it. I declare the motion adjourned.